Hi, I'm Courtney Ayers. I'm a third-year vet student at Texas A&M University, and I just want to talk about my experience during my 10-day externship at Eastwood Animal Clinic. So I first met Dr. Sammy my very first job and career fair during 1VM. It was just him that I talked to. We talked for probably 20 minutes. I know he was actually the booth I stayed at the longest. It got me really excited. I didn't go until my 2VM summer. After first year, I was kind of nervous to go into a clinic. Anyway, then I met with Lynette for basically dinner and the externship fair during 2VM. And after that, I was kind of sold. They're really just awesome people, genuinely. Dr. Sammy's really awesome. Lynette's really awesome. Their entire team is really awesome. But I just want to talk about my experience there. So I was there for about 10 days and I had a couple things I really wanted to focus on. A lot was surgery as well as auscultating, just because I feel like while we get experience in school, I want to know normal versus abnormal more. So the nice thing is with Dr. Sammy is you are just thrown into it, and I mean that in the best way possible. So I learned by doing, and surgery as a technician made me really nervous. I got really nervous in surgery lab 2VM. So that was kind of my main thing I wanted to focus on. And I mean, first day, pyometria, splenectomy, glove in, assisting. I insert a Penrose drain my first day, and I did a lot of suturing, mattresses, a lot of different suture patterns. And the nice thing is I didn't feel rushed and I didn't feel judged at all. I felt very comfortable in the surgery suite. And it's really nice just to kind of be thrown in. And then the second thing is the way that the actual hospital works as far as appointments. They're walk-in only, so you never really know what you're gonna see. And the best thing about it is that the technicians bring the animal back into the treatment area, so you get to do pretty much every physical exam. Every time they walk an animal back, you can do your full physical exam on them. You auscultate them, you kind of brainstorm a plan, and then Dr. Sammy or Dr. Gibson, you kind of go over their findings. If you're not sure about something, you can go ahead and tell them I heard this, but I'm not sure. And the nice thing as well is that their staff is so intelligent and so good at their job, is a lot of the times you can kind of check with them. I thought I heard a murmur, but I wasn't sure. And it's kind of nice to bounce off of them, and then you can double check it with the doctor. Just kind of aside from getting a ton of hands-on experience, I read a lot of radiographs, I performed a lot of ultrasounds, and I would go over it with the doctor. He would, Dr. Sam would be like, what do you see here? What could that mean? What are some differential diagnoses? And it's really, really nice to learn that way. I don't learn very well just memorizing a chart. I have to actually do it for myself. And then kind of last thing is kind of apart from, hospital stuff. It is genuinely one of the most positive clinics I've ever been in. I've worked in many clinics before for a long time. I was a tech for 8 years. So the fact that on the very first day, I saw Dr. Sammy walk around and high five or hug his staff before he left just kind of says a lot about the culture in the clinic. Everybody works really hard. The thing is if you go jump in and help, everybody's very kind about it for blood draws, IV catheters, auscultating, helping with rads, helping with ultrasound. It's the way to learn, and the staff are so nice there. So I couldn't recommend it enough. Thank you.